Well, thank you very much. We talked about vision last week. This is the second of the senses, hearing. And it's probably second in importance to our senses. So, what do we actually hear? Well, we hear sound, and sound is a pressure variation transmitted through something, usually air, and it's a wave. And the characteristics of sound are they have frequency, wavelength, and speed. They also have amplitude or loudness, and they reflect, as you know from the oak from the dining room, they reflect off walls. They interfere with each other. The amplitude of the sound wave we detect as loudness, and the measure of loudness is decibels. The bell part is in honor of Alexander Graham Bell. The deci part is because the units are in measures of 10. And so the frequency of the sound wave that we hear is we notice the pitch. I have a problem here. This is not advancing. Ah, there we go. Okay, right. Okay, so we have pitch or the frequency of sound. The loudness is measured in decibels, and the quality, the timbre, whether it's music or whether we hear it just as noise. So normal human hearing, we hear between 20 and 20,000 hertz or cycles per second. The volume we can hear from 1 decibel louder, but most of the sounds are from 2,000 to 5,000 hertz. And human speech, normal human speech, is between 2,000 and 4,000. So most of this range that we hear, at least when we're born, we really don't use. But below 7,000 hertz, if we don't hear that, we begin to detect some impairment in how we hear. And if we have a slight impairment, it means we are 20 decibels down in volume, moderate 40 to 50, and significant between 50 and 70. Now, to put that in perspective, normal human loudness, if we talk to each other, is about 65 decibels. And so here is the range that you need to understand. If we look, 0 decibels is silence. So the 10 decibel at the bottom is really quiet breathing, very, very soft. If we go to leaves rustling, a little bit louder, we go to 20 decibels. Now, that is not 2 times, that is 10 times. And if we go a little louder to a whisper, 30 decibels, that's 10 times 20 decibels. So to go from 10 to 30 is really a factor of 100. To go from 10 to 40 is a factor of 1,000. So those of you who are mathematically inclined, this is a logarithmic scale. Now to go to our loudest sound, the gunshot at 140 decibels, that is approximately 100 trillion times as loud as our quiet breathing. So this is an enormous scale that we're talking about. The important part of it is the part below 80 decibels, because at this point, there's no damage to the human ear. You can listen to sounds like a truck going for all day, no damage will occur. Between 80 and 90 is a range where we're beginning to get a little bit of damage, and now it depends how long the duration of the sound is. So if it's short duration, there's no damage. We have an area between 90 and about 115 decibels, the red part on the right-hand screen. And this is a range where there will be some damage, but as long as the duration is relatively short, and now we're talking less than an hour, it's reversible. So some damage will occur, but the ear can heal. And then above 115, we're talking about irreversible damage. And the time duration, now you're talking less than a minute. So even though a gunshot is very short, less than a fraction of a second, damage will occur. And unfortunately, the damage is cumulative. So with normal aging, we lose our higher pitches. So if you're less than 20 years old, you can hear these high pitches, 17, 18,000 hertz. By the time you're in your 30s, you're down to about 16,000. 50, you're down to 12,000. And so you lose the ability to detect this higher frequency. Uh, this causes a little bit of difficulty in hearing because if there's background noise, even at low volume, you're having difficulty differentiating. And then as we get older, we lose some of the elastic tissue in the ear, and that is a problem. So here is the ear. The ear is really two organs in one. We hear with it, and it also has to do with our equilibrium and balance. So we have the outer ear, which is the earlobe. That's the only part of the ear we actually can see. We'll talk about the middle ear, which is right here. It's an air-filled cavity. It has three little bones that connect from the eardrum to the cochlea, which is really the organ of hearing. And then up here we have our balance system. And then we have the acoustic nerve that goes from the cochlea to the brain. Since the middle ear is really a air-filled place, we have a tube that extends from the middle ear to the back of the throat, the eustachian tube. And this normalizes the pressure between the world around us and the inner ear. So if we look at the outer ear, you have to understand that we only get about 5% of what's really out there. Our ear is not terribly efficient, but we have a canal that leads to the eardrum, which is what really receives the sound. Now, we're one of the few animals that can't move our ears. Some people can wiggle them, but compared to my cat, we don't wiggle our ears. And that's a problem because we can't zero in on the sound, and the earlobe is not terribly efficient. If we go to the middle ear, we have three little bones there, and they amplify the sound, but they transmit the sound from the eardrum to the cochlea. Now, the inner ear is the actual part that does the hearing. And so the cochlea is this little coiled area here. It's got about 2.5 turns, and this is the organ that actually hears the sound. Now, in addition to that, we have this stuff up here, the semicircular canals, and a thing called a saccule and an utricle. This is what orients us in space. This is how we know which end is up and whether we're moving. And so if you look at these two, we have one here that's horizontal, one that's vertical. And what it is cells which are sensitive. It's in a sort of a jelly matrix. And then we have these little stones here, which are sensitive to gravity. So it's the pull of gravity on this, which tells us if we're standing upright or if we're lying down. And then these three semicircular canals tell us if we're moving our head and which direction we're moving it in. Now, the cochlea itself is an interesting structure. As I said, it's about 2.5 coils, and we hear different sounds at different places in this instrument. So next to the middle ear, right here, where the three little bones in the ear are connecting to the cochlea, that's where we hear our highest pitch sounds at about 20,000 hertz. As we go along this structure, you see that the sounds get lower and lower in pitch until we finally come to the very apex where we hear the very low sounds. Now, this structure is interesting because here's our connection with the middle ear, this last of the little bones. It connects to a membrane, and behind it is fluid. And so when we have sound, this gets thrown into motion, and the wave is transmitted in this fluid, which goes all the way around to the end and then comes back here. So this is one continuous channel. There's a little membrane here called the round window, which just seals it off. Now, this stuff in here is the organ that actually hears, and it's on a membrane right at this lower channel. And what is happening inside the ear? Well, here's our upper channel, here's our lower channel, and here's this middle channel, which is completely sealed. And this structure here is called the organ of Corti, and that's actually what we're hearing with. So the sound waves are coming through this fluid-filled space. They're stimulating this organ, which we'll look at in a little greater detail. And here is the nerve that goes from the organ of Corti out to the brain, the cochlear nerve. And you notice that it's exposed right here because this is going to be important when we talk about cochlear implants. So here's the organ that actually hears. It's got some sensitive cells here, they're little hairs that sort of touch this membrane. And so the sound waves can be transmitted one of two ways. It can come from down here to stimulate these cells, or it can come from up here, go through this membrane and stimulate the cells. But that's how we hear. Now, we also hear from the bones of the head. So in addition to going through the air, through the middle ear, to the cochlea, we could also go directly from the bone that surrounds that structure to the round window and get their stimulus that way. So how do we measure? Well, we do audiometry, and we're measuring from 125 hertz in segments of 125 hertz from 8,000 to 10,000. And we measure the intensity or the loudness from 100 decibels from 0 on up. So we go in 5 decibel steps. So what we're trying to do is measure what can you hear and how loud can you hear. And then since we use the bone also, we can put a vibrating tuning fork or some other instrument on the bone and see if that will pick up the sound. Unfortunately, we can lose our hearing in any one of these structures. We can close off the outer ear by blocking the canal or with a foreign body or just a lot of earwax. The middle ear, we can damage the eardrum, or we can damage those delicate 3 bones. Or in the inner ear, we can damage the nerve. And unfortunately, there are some infections like measles and mumps and meningitis that can affect the nerve. Loud sounds are the major cause. And there are, unfortunately, people where there's a congenital problem, either in the bones or in the nerve, and that leads to loss of hearing. So the types we have conductive, which means the sound doesn't get through to the middle ear. It gets blocked. Sensorineural, where there's a problem in the inner ear or the nerve. And then we have this mixed type, which is both. Then we have this thing called auditory neuropathy spectrum disorder, where the sound gets in the ear normally, but because of damage to the inner ear or damage to the nerve, we can't recognize the sound and the brain can't figure out what's going on. Hearing loss can be mild. We can hear the speech, but only loud speech. We can't hear the soft sounds. Moderate, we can hear speech. We can't hear speech at normal levels, but if you shout, you can hear it. And then severe, where you can't hear speech at normal levels and can hear only loud sounds. And then profound, you can only hear the very loud sounds. Now, at the oak hammock population, we have a problem with tinnitus because this occurs more often in older folks. At folks our age, it's about 10 or actually 15 to 20% of the population can be in one or both ears. It varies in volume. It can be a low roar. It can be ringing, buzzing, clicking, hissing. The point is, it's sounds that you're hearing that are not out there, and they're quite annoying. It can be intermittent, constant. Sometimes you hear it with the heartbeat, a pulsatile. And if what's causing the tinnitus can affect other parts of the ear, we can also affect our vestibular system and get some dizziness along with it. Common causes: hearing loss, damage to the cells, infection, blockage of the ear canal, injury. A lot of medications also cause it. Some antibiotics, diuretics, antidepressants. And so that's relatively easy to take care of. You just change the medication. There are a lot of uncommon causes, including eustachian tube dysfunction, spasm of the little muscle in the ear, temporomandibular joint. There can be tumors, can be blood vessel changes, hypertension, diabetes. A lot of things can cause tinnitus. Main risk factor probably is loud noise exposure and age, just aging. More men than women seem to be affected by it. Tobacco, nobody has anything good to say about tobacco. Alcohol use, high blood pressure, and it is terribly annoying. So the complications of just having tinnitus are fatigue, stress, sleeping problems, trouble concentrating, depression. It's really quite annoying. My father had it, and nothing that he was tried with really helped. He just had to live with it. To prevent it, try to protect from loud sounds, turn down the volume, keep your heart and blood vessels healthy. In other words, control hypertension, and limit the alcohol and tobacco use. Treatment, if it's treatable, like removing earwax or treating hypertension, that's great. Hearing aids help because they increase the volume of the sound so it overrides what you're hearing with the tinnitus. If medication, of course, you change the medication. The white noise machine is simply to give you a background noise to make the tinnitus less noticeable. So it's basically a masking or a blocking. Counseling, cognitive behavioral therapy, of course, it doesn't help the tinnitus, but it helps you cope with it and live with it. As far as I'm aware, there are no real good medications for it. In the past, we used antihistamines. As far as I know, they did not help very much. There's a few potential things in the mill, like the transcranial magnetic stimulation, deep brain stimulation, to try and eliminate that. This is not really available for public use. There is a problem in the community with hearing loss, especially with hunters. About 80% of hunters have hearing loss, and that's simply because they're in a noisy environment. People who are in law enforcement, rock musicians, because of the loudness of their environment, there is a considerable loss of hearing. And in the states that we show, the states with the greatest proportion of hunters seem to have the greatest proportion of hearing loss. It's an impact on seniors because we're high in hearing loss. And as you see, the couple where the wife says, I think you need a hearing test. And he hears, but he doesn't hear well. Why the heck do I need a hairy chest? In other words, part of the problem is not that you don't hear, but you don't understand what you're hearing. And along with that comes depression. You feel lonely, angry because you have it. It's a problem with personal safety because if you go out, you may not hear the car or you may not hear things that you should be hearing. And so it leads to poor health and sometimes a cognitive decline. The chart shows that with aging, there's an increase in loss of hearing. And if you're 65 to 75, about 25 to 30% will have some impaired hearing. As we get older, it gets to be 40 to 50%. This is true in our noisy society. If we look at some cultures that are so-called primitive, but they're quiet, and the elderly there do not have hearing loss. So part of it is the noise in which we live. How to treat it? Well, we have hearing aids to amplify the sounds. We now have cochlear and brainstem implants. We can use bone-anchored hearing aids if we can pick up the hearing that way. And then we have other devices like audio loop systems like we have in the room here, closed captioning, telephones that show you text as opposed to sound. Now, cochlear implants are becoming more and more available. It's a very complex device. Worldwide, there have only been about 300 plus thousand of them. In the United States, only about 58,000, of which most of them, or a large part, have been in children. And these are for people with severely impaired hearing. It's a very complex device. And what it is, it's an electronic device that gives a sense of sound to somebody who is profoundly deaf. And it has these components. You have a microphone, a speech processor, and a transmitter outside, hanging around your ear. The inside electronics are the receiver, the stimulator, and an electrode array. In other words, there's a little fine wire that goes into the cochlea that transmits the impulses. Now, fortunately, because you hear at different areas of the cochlea, so you can have about 30 or so transmitters on this wire, and you have them stimulate particular parts of the cochlea. So if you're hearing a sound of, say, 5,000 hertz, this device will send an impulse to the transmitter at the 5,000 hertz portion of the cochlea to stimulate the nerve at that point. And so it's very different than a hearing aid. When you have a cochlear implant, you have bypassed the entire ear, gone directly to the cochlear nerve. And so it's a direct stimulus to the auditory nerve. Hearing is not normal hearing. I think people who have it relearn, but they can recognize the sounds, they can recognize speech in their environment, and they can understand speech. So it is a great device. The bottom line is that we live in a noisy environment, and about half of us will enjoy close to normal hearing as we age. We will not hear the super high-pitched sounds, but then again, we don't have to. And the technology, unfortunately, cannot replace the sound discrimination that the brain has in normal hearing. The hearing aids are getting better and better at this, but there is no real substitute for what the brain does. So it's a problem. As you see, there's some difficulty in hearing, and the poor zebra is losing his stripes. So I'm sure there are questions. If you have questions, I'll be glad to try and answer them.
We have questions?
I'm sure we do.
Hi, Joe. That was a nice summary. Can you hear me?
No, not really. I don't hear you. Is the microphone on?
Turn it up. Nope. More. Okay, let's see. Okay. You said there's no cure for tinnitus, but I seem to hear some ads going on saying that they can cure tinnitus now.
As far as I'm aware, there is no cure. I mean, you have it. You have things that can block it, and things you can do to try and alleviate the annoyance of it. I'm not aware of anybody who can cure tinnitus.
There's no cure, but you can alleviate some symptoms.
Not yet, hopefully.
So and is it lifelong then? It lasts forever?
Well, it doesn't. I mean, it depends when it starts. A lot of times it will start when we're 50, 60, 70 years old. So, but unfortunately, it will last the rest of your life. Now, I guess if there's more damage to these cells, you could probably get rid of the tinnitus, but at the cost of your hearing. So maybe the cure is worse than the disease.
Talk real close into.
My husband had tinnitus, and it was caused by one of the medications he was taking. When he stopped the medicine, it cleared up. So if you have it and you're concerned, I would check with your doctor and look at the side effects of some of your medicines, because happily that's what was causing it, and they were able to change his medicine. A quick question. Over-the-counter hearing aids, I know those have been introduced. Are they of adequate quality? Are they worth it?
Well, let me talk about the tinnitus. If it's from a curable condition, like you've got a lot of earwax that can be removed, or a medication that's causing it, or high blood pressure that's causing it, then yes, you can get at the cause of the tinnitus. But for most people, you can't. As far as the hearing aids that are over the counter, there was a change in the law that allowed these people to put these in the public domain. And they're not fitted as you would have a hearing aid from an audiologist, but apparently they are fairly good. So it's a question, if your hearing is not greatly impaired, it's worth a try. They're considerably less money than the audiologist fitted hearing aids.
Hi, Joe. There are people who hear things nobody else hears, like schizophrenics and auditory hallucinations. Is that outside the realm of ordinary medicine? Something for shrinks or just whatever it is?
Well, I think that's not coming from the ear, that's coming from the brain. So,
You have a question? Okay.
Joe, since we use this room so much, do you think this room is adequate? Do you think that the reverberation of the sound interferes with our hearing? And sometimes the loop works and sometimes it doesn't. What do you think of this room?
well, it's hard for me to answer that because my hearing is, I think, pretty normal. So I don't have a problem, but the walls are not soundproof, they're not sound absorbing material. So there is a reverberation, especially in the dining room, there's a reverberation. And part of the refurbishing of the dining room will be to soundproof it better. Now, the problem is if you have impairment of your hearing and you need a hearing aid, it can't discriminate as well as the human brain can from extraneous sounds. I know I had the experience when I was doing surgery. I didn't hear anything that was coming in. There was music in the operating room, but I didn't hear it until I was finished. So the human brain can turn off the sound. It can do things that hearing aids can't.
I wanted, hi Joe. I wanted to ask about the eustachian tubes. What, why does eustachian tube? I mean, it's just a tube. Why does it, sort of what does it do, and why does dysfunction affect hearing?
Well, it does affect hearing if it's blocked. It is a connection between the middle ear and the back of the throat. Now, if you've got a cold and that's blocked, and then you go up in an airplane, you're going to be miserable because the inner ear is now at ground level air pressure, and the airplane is at 5,000 feet pressurized. And that's why you try and clear your ears. You know, the plane goes up and they tell you to take a hard swallow or to take a cough or something to try and equalize the pressure between the middle ear and the outside. So the eustachian tube is important. The middle ear is air filled. That's where the three little bones connect.
But why does pressure?
Well, you have to equalize the pressure. You can't have a pressure in one part of the body and higher or lower than the outside pressure.
Yeah, it just doesn't seem like that would affect the ability of the those little bones that to impact the round window or whichever window it
Right, well,
was.
It's not the bones, it's the fact that the middle ear is filled with air. You've got to have equal air pressure everywhere. So here, the pressure in your middle ear is the same as the pressure in the room. But if you go up in an airplane and the pressure is lower in the airplane than it is in the middle ear, you're going to feel pain. It's like having pain in your gut. You know, it senses the difference in pressure. So it's a way the body equalizes the pressure.
Hi, can you hear me? Okay, I'm asking a question on behalf of someone who has lived with somebody I live with somebody that has loss of hearing, and I grew up with a mother that has loss of hearing. And as someone who has good hearing, the hard part is not necessarily when you're talking to him. I find it very difficult when we're watching television and there are subtitles and the pictures in English. I do not have a problem with watching a film that is foreign and having the translation. Well, there doesn't need to be. So I'm wondering what causes a person that does hear to to not concentrate when there's something interfering with the language.
I really don't know how to answer that.
Anybody else?
I've seen movies with subtitles. I don't have any problem with them. A lot of times, if it's a British film, the English will be such that I don't understand it, even though it's English, and the subtitles are important. But I don't know.
I just want to give a shout out. This morning I started using, because of the uptake in the buzz saws, the lawn people, because of the storm. It drives me crazy. Normally it's so loud. So I got some Bose Ultra Comfort noise canceling headphones, and they're fantastic. And you can even use them to listen to TV, and the person in the same room, if they don't want to hear TV, they don't hear it. Anyway, I am thrilled because I tried them just this morning and they work beautifully. So
Right. There is a gizmo you can attach to your TV that transmits directly to a hearing aid or to a set of earphones.
There was a question on here. What is a loop in a room?
Usually it's I think an infrared thing, but it's a wire that goes around the room that transmits the sound that hearing aids can pick up. So it's a way of going directly from my microphone to your hearing aid. And there are a couple of ways in which it's done. One is by infrared, one I think is ultrasound, but that's the idea. The idea is to have your hearing aid give you what I'm talking.
Glenn, are you there?
Yes.
Talk
Some,
loud.
some years ago, my mother had a disorder called benign proximal positional vertigo. And they tried to reorient the cause of it, which they said was crystalline material within the utricle part of the balance system. Is that a legitimate way of dealing with that? I guess this is a cause of people feeling dizzy or unbalanced, which I noticed that now I'm in that age group. I have experienced myself.
Right. The ear has two functions. It hears and it gives us our balance and sense of motion. And the utricle and the saccule are the organs that do this. They have these little bones in them. Not bones, are really like little stones. They call it otoliths, but they're sensitive to the force of gravity. And that's how we know which end is up. The semicircular canals give us our sense of motion because there's fluid in the canals that gets thrown into motion if we move our body or move our head. Now, problems can occur in this structure also. I didn't talk too much about it because it's not related to hearing, but if something happens, yes, you lose your sense of which end is up. And so we very much depend on these. There's nothing that I'm aware of that can correct something going wrong. The good news is that very rarely does it go wrong. But keep in mind that the ear is encased in hard bone. And so to get to it, to put in a cochlear implant, to put in that wire, they have to drill through that bone. To get to the saccule and the three semicircular canals is extremely difficult. But even if you could get there, I don't know what you would do about it. In other words, I don't have a good answer to your question, and I don't have anything to suggest to help the person who's afflicted with it.
I have had that benign vertigo several times, and there's a maneuver called I think it's called the Epley maneuver, and it's where you fall backwards. Sorry, it's where you fall backwards as you're turning your head. And I can't remember you. It depends on which side of the semicircular canals, left or right, is the one that's causing the problem. But in any case, you turn your head and you put a pillow so that your head kind of tilts way backwards. And then you move your head 45 degrees to one direction, hold it for 30 seconds. You turn it as far as you can, or 45 degrees rather, to the other direction. You hold it for 30 seconds. And by the way, when you do this, after you've had that, it's going to make you feel very dizzy. It's not a comfortable thing to do, but you can do it. And that is very effective. I can give you personal experience because I've had this a number of times, and it really does work. You might have to do it 2 or 3 times, but it does really help.
I'm glad you have something that works. I know when we do testing of these semicircular canals, you have a thing called a Barony chair, which can spin you in different directions. And we look at the motion of the eyes because it causes the eyes to move. And we know if these canals are working. The problem is if the canals get blocked or something happens where they don't work the way they should, anything that could help would be a plus.
Is there any other questions? Okay.
I have a couple of comments. One, I kept falling out of my boat in the Gulf of Mexico, so I figured I'd better get some cheaper hearing aids. And so I bought some online. The quality of the sound is very poor. It was adequate for me to hear the other people in the boat, but it was very poor. And they lasted about a year. And then, so it was $500 down the drain. So I don't know how the new ones coming out may be better, but the ones I had were pretty poor.
Well, the new ones are definitely better than what you had before, but keep in mind if they work, that's great, but you may need something more, and you may need something more specialized or more high tech than what's available over the counter.
Thank you very much, Joe. That was very interesting. I just want to make a comment. I went to the audiologist several times on my wife's suggestion. And after a couple or 3 years here, the audiologist said, well, you have marginal hearing loss, so you would benefit from hearing aids. So I got them. And the point that I want to make is if you were qualified for VA, which I'm not, you should go there because they don't check to see whether you need the lower, middle, or upper class hearing aids. Everybody gets the top of the line $5,000 to $6,000 hearing aids, and they adjust them as needed because they'll last the rest of your life. So I have middle of the line that I had to pay for myself for about $3,000, but they work very well. But I still get the suggestion from my wife that I don't hear very well.
Well, there's 2 things here. Either you're not hearing well or you're choosing not to listen. And you have to differentiate.
Okay. Any other questions?